How are you doing today?
I'm good. How are you?
Good. My name's Molly. I'm going to be your student nurse for the day. Can you confirm your name and date of birth on your wristband?
Addison Callis, 120602.
Okay. So today I'm going to be doing a bedside assessment on you. So I'm going to look at you head to toe. So I'm going to look at your eyes. And then I'm going to feel your skin in some spots. And then I'm going to listen to some lung sounds. Are you okay with that?
Mm-hmm.
Okay. Are you in any pain today?
No.
Okay. So general survey, patient is sitting upright, she's alert, she looks her stated age, and she is pleasant, and she is tan in color. So to start, I'm going to ask you a couple questions. So if you could tell me your name again.
Addison.
Okay, and then if you could tell me where you are.
My house.
Okay, and then if you could tell me the day of the week it is.
Tuesday.
Okay. Next, I will put you on the Glasgow Coma scale. And then I'm going to take a look at your eyes. Okay, so first I'm going to measure them. Okay. Alright. Next, if you'll just follow my light into your nose. Okay. And then I'm going to shine my light in your eyes. If you'll just look straight ahead. Okay, so next I'm just going to take a look at your respiratory effort. So I'm just going to put on your smoke ball really quick. Okay. Alright, next I'm just going to take a listen to a couple spots, and if you'll just breathe in and out of your mouth whenever I place my stethoscope on your skin. Oh, sorry. Now I'm going to get one down here. Alright, and then I'm going to get the side. So I'm just going to go right here. Right. Alright. On this side. Sorry. Alright, and now I'm going to get a couple on your back. Alright, so the next thing I'm going to do is have you lay down for me. Okay. Okay, so I'm just going to osculate your apical poles. So I'm going to lift up your sports bra here just for a second. Sorry. Sorry. Alright. Next, I'm just going to take a look at your stomach. So if you could pull your pants down just a little bit. Thank you. And then if you could tell me your last bowel movement.
Yesterday.
Okay. And then if you could tell me the last time you urinated.
Like 10 minutes ago.
Okay. Next, I'm just going to listen to your stomach. And then one more thing, I'm going to palpate, so let me know if you have any pain. Any pain? Okay. Any pain? Okay. So next I'm gonna have you roll over for me, if you could, onto your side. Perfect. So now I'm just gonna take a look at your scapula, your vertebrae. Sorry. Your vertebrae. I would inspect the coccyx, and then I'm just gonna take a look at your ankles and heels. Okay. Awesome. So you're good to sit back up. And then I'm going to take a look at your elbows. Alright. Awesome. And then next, I'm just going to take a look at your overall skin. So I'm going to look at your arms. Okay. Alright. And then I'm going to palpate your arms. So if you'll just give your awesome. Okay. Alright. And then I'm going to assess capillary refill if you'll give me your 2 pointer fingers. Alright. And now I'm going to take your radial pulse. So pulses, sorry. Alright. And then if you could pull your pants shorts. Awesome. Alright, next I'm just going to take a look at your legs. Okay. Alright. Alright, and then I'm going to palpate your legs. Alright, and then I'm going to check for edema. Okay, next I'm going to take your dorsalis pedis pulse. You can leave them on the ground, but if you'll flex your big toe up, okay, and then you can relax. Alright, okay, and then if you could squeeze my fingers. Okay, and then I'm going to have you scoot back for me, and then bring your feet up, and then push, okay, if you'll point your toes up, or your feet up, sorry, and then push down, okay, and then if you could lift your feet slightly up, and then your whole foot, sorry, and then push up, okay, perfect, okay. So that concludes my bedside assessment. Can I get you anything else?
Mm-mm.
Okay.
Thank you.
Thank you.